Leading local in our top story, in America's drug crisis, lawmakers grapple with a tug of war between regulation and innovation. But for leaders of tribal lands from areas which are disproportionately affected by drug abuse and addiction, there is no debate. They say they're ready for innovation starting now.
According to Scott Davis, the former commissioner for the Bureau of Indian Affairs, the Native American drug crisis is compounded by one key problem: a lack of hospital beds. Throughout tribal lands, treatment centers are hindered by Medicaid's 16-bed limit, despite demands for more inpatient care in the community, especially in the wake of a growing opioid crisis that often requires people with addiction to stay in inpatient treatment longer. Coupled with staffing shortages, tribal treatment centers are left juggling costly referrals to out-of-town or even out-of-state treatment centers. And even worse, it leaves natives struggling with addiction with long waited times that jeopardizes their chance of recovery.
When you're limited to 16 beds and there's such an overflow or a waiting list, to get in recovery, that's what we're talking about. That's very, very common, very, very normal on reservations. So now, if they said, no, we don't have a bed available, well, you're going to wait another 2 weeks, 3 weeks, a month. And what does that do for me as a person who's addicted? I'm probably going to go continue to use. That's the nature of the disease that we have.
Davis says state lawmakers need to work with tribal care centers to waive the 16-bed limit imposed by Medicaid, providing services that are realistic to the needs of Native Americans. He believes this will come at no cost to the state, since funding for more beds is reimbursed by the centers for Medicaid and Medicaid services. There's also needs to be more tribal inpatient centers. These centers are vital for Native American communities since they often incorporate cultural practices like sweat lodges and elder speeches to ensure a holistic healing that's often lost in translation with Western medicine. In this way, Davis believes lawmakers can reinvent recovery for North Dakotans.
I think the importance of the state and the governor's office to find an innovative way to make this work. That's got to be strong because, again, recovery reinvent it. Let's reinvent this way of the Medicaid waiver.
Bismarck's Native Inc. and Native Development Center offers peer support services for natives struggling with addiction, mental illness, and more.